Bipolar disorder, part 2. Nevertheless, analyzing the symptoms and arriving at the proper conclusion can be highly challenging, even for a medical expert. Bipolar disorder is the chameleon of psychiatric disorders, changing its symptoms presentation from one patient to the next and from one episode to the next, even in the same patient, writes Dr. Francis Mark Mondemore of the Johns Hopkins University School of Medicine. It is a phantom that can sneak up on its victim, cloaked in the darkness and melancholy, but then disappear for years at a time, only to return in the resplendent but fiery robes of mania. Clearly, mood disorders are difficult to diagnose and can be even more difficult to live with, but there is hope for sufferers. In part, this may be due to their postpartum depression as well as hormonal changes that menopause into. Women are usually more inclined to seek medical attention and hence receive a diagnosis. Some names appearing in this series have been changed. Doctors report that often each mood persists for many months. However, they know some rapid cyclers facilitate between depression and mania several times per year. In rare cases, sufferers switch from one extreme to the other with a 24-hour period. Stability is a place that bipolar people visit. None of us actually live there. A depressed mood most of the day, nearly every day for at least 2 weeks, loss of interest in one's pleasurable activities, significant weight loss or gain, excessive sleep or the opposite, insomnia, and abnormal speeding or slowing of motor skill, excessive fatigue with no discernible cause, feelings of worthlessness and or inappropriate guilt, diminished ability to concentrate, recurrent thoughts of ending it all. Some of these symptoms may also indicate dysthymia, a mild but more chronic form of depression. The list is presented to serve an overview and not to provide for making self-diagnosis. Also, some of the symptoms by themselves may be symptoms of other problems besides the depression. Hope for the sufferers. In the past, people tended to avoid those who suffer from mood disorders. As a result, many were afflicted because social outcasts. Some encountered job discrimination. Others were shunned by members of their own family. Often, the only aggravated the problem and prevented those who were alien from getting help. In recent decades, however, great strides have been made in understanding clinical depression and bipolar disorder. Now it is well known that these conditions are treatable, but getting help is not always easy. And why?